So welcome
Yeah.
everybody to this session today. Another exciting session talking about what are the steps we need to take given the current funding situation to sustain laboratory services. Today we have the pleasure of having Dr. Umaru, and he will be able to introduce himself during the presentation. But as usual, please put your questions into the chat box and also select the language of choice. So we have Portuguese and French translation. So please select what is appropriate. And at this point, I'd like to welcome Dr. Umaru to share his slides, introduce himself, and give his presentation. Over to you, Doc.
Well, thank you so much for your time, everyone. Thank you, ASLM, for the opportunity to present this very important topic of today. Just a little bit of background. This topic came into being following the publication that I presented an opinion paper in ASLM, AJLM, entitled The Impact of the U.S. Foreign Aid Freeze and Urgent Call for Action. So ASLM reached out to me to do this presentation in order to be able to kind of share my opinion to everyone. And also at the same time, we want to be able to kind of crowdsource opinions or innovative ideas that our leaders, will take from here to be able to address some of the major issues that we are facing. So really, this presentation is about, how the PEPFAR freeze threatened decade of progress in HIV diagnosis. Before I go into the detailed presentation, I want to read the disclaimer because this was insisted by the publishers for me to put in during the publication, and that is actually the case for me. I want to say that the views and opinions expressed in this article, and for that matter, in this presentation, are those of the author, that is myself, and are the product of professional research. I've used open source data and articles that are openly available. The article does not, or this presentation does not necessarily reflect the official policy or position of any affiliated institutions, funder, agency, government, or that of the publisher. The author, that is myself, is responsible for these articles in these presentations, results, findings, and content. So with that disclaimer, we want to go into to look at the agenda for today, this morning, this afternoon, or this evening, wherever you are coming from. We'll start by really looking at the background and progress of PEPFAR, and then we'll look a little bit about some of the key achievements of PEPFAR within the laboratory landscape on the continent. And then we will discuss a bit more of the risk and the impact of that executive order, which called for foreign aid freeze. And I would like to end the presentation with a call to action. I gave leadership 4 areas to consider in terms of the call for action. But before that, a little bit about myself. Over the past 25 years, I've done a lot of public health work, especially under the PEPFAR program. Starting from my birth country, Ghana, where I work with the regulatory agencies on the country for about 5 years. And then I moved to Namibia under a US government supported project called RPM Plus project with MSH, Management Sciences for Health. And then moved into Zambia, where I spent bulk of my time under the PEPFAR program in supporting the laboratory diagnostics laboratory services, especially in the area of supply chain, where together with our team, and the Ministry of Health, really transform, laboratory diagnostics and laboratory system strengthening on that in that country. And I'm proud of the work that the team there, have done and are still doing. And now, based on that success, I was transferred from the Zambia field office to the headquarters, to the headquarters office in the United States. And since then, that is from 2012 to date, where I work under the previously SCMS, which is a supply chain management system project. That's transitioning into the PSM that is currently ongoing or about to be terminated. And then I work at the US Pharmacopoeia as well in Amentum and recently in USAID until January 2025. So this is kind of me, in terms of the work that I've done, a lot of work in the area of laboratory services, both in the area of quality assurance, quality control, and also in supply chain. So with that being said, I just wanted to kind of really now give us a little bit of a background on PEPFAR. PEPFAR, of course, we know is a presidential emergency plan for HIV release. This started around FY 2023 with a U.S. government commitment of about $15 billion over 4 fiscal years, that is 04 to 08. And that has significantly increased to 48 billion up to date. So around 48, 50 billion is what is currently being committed. And actually that forms, through PEPFAR, the US government has, invested over 110 billion in the global HIV response. And that became actually the largest commitment, by any nation to address a single disease in history. So with that being said, I just wanted to kind of briefly let us know in terms of how PEPFAR appropriation is done. So first of all, Congress appropriate, funding, PEPFAR funding to the U.S. State Department. So with the appropriation, we have 4 years of appropriation. And one good thing is that, PEPFAR has been able to go through 4 different administrations over the year that has been set up. And so with an annual budget of between, $5 to $6 billion, which is mostly kind of stabilized from 2009 to date, the commitment is kind of performing most of the critical work in terms of the responding prevention, treatment, diagnosis, and care of HIV. So coming back to how the appropriation is done, when Congress appropriate, the funding, it goes through U.S. Department of State. Now, U.S. Department of State, under the U.S. Global AIDS Coordinator and Health Diplomacy, oversee the implementation or oversee the allocation of this funding within the Departments of Global Health Security and Diplomacy, or GHSD. Now, the funds, are allocated to 7 implementing agencies, U.S. implementing agencies, including USAID, CDC, Department of Defense, DoD, etc. So, which means that, most of the implementing agencies, federal agencies, especially for USAID, which is involved in procurement, supply chain, and technical assistance in this area of international development. So it means that, dismantling USAID means that, the services that we are getting through the USAID will definitely, come to still. So that shows you in terms of, the risk and the reasons why we need to begin to take action in terms of that. But looking at the funding, you can see that, throughout, it has been flatlined within 6 billion, except for 2021. And I'm pretty sure you will easily notice that 2021 10 billion is really because of the emergency funding as a result of COVID. So with that in mind, PEPFAR at its own best really has been able to touch, across the cascade of health prevention and treatment globally, and in providing, over 25 million people on treatment. So PEPFAR actually is proud of the work that they have done. I got this from the website, where it's saying that they have remarkably expansion of life-saving services with the flat budget. And of course, the budget has been flatlined. We saw it earlier on, but yet still that, they've been able to kind of achieve really dramatic success in terms of putting millions of people on treatment, over 25 million people on treatment. Babies with HIV free, about 5.5 billion. PMTCT, prevention of mother-to-child transmission in diagnosis, etc. So this is kind of the historical background in terms of how PEPFAR is established and how it operates, and some of the key historical perspective that has shown progress of PEPFAR. Now, with that background, now I want to kind of shift a little bit to look at what are some of the major investment areas, specifically in the laboratory and diagnostics field. This is kind of a broader perspective of the general work that PEPFAR has done, globally. Now, specifically on U.S. investment in Africa laboratories, there are kind of two main areas that the investment goes in. And I mentioned earlier on that the implementing agencies differ. So I want to let you realize that some of the work that CDC is doing is also part of that work that is implementing, because CDC is also an implementing agency. So first of all is the TA, that is technical assistant. So they have what you call the 3 Ps in terms of technical assistant, which is technical assistant in policy, population, and partnership. So what that means is that, helping to shape some of the diagnostics policies that we have in Africa or even globally, in terms of making sure that, countries are able to respond to new treatment guidelines, for example, to new treatment required that is maybe coming out by WHO as well. And also making sure the right population get the right services that they need, patients, community level, getting the services that they need. And most importantly is partnership. We're working with government, country government in a bilateral form, making sure that, countries have been able to accelerate their own progress with the support of PEPFAR. And some of the technical areas that, just kind of just highlight here are in the area of supply chain, which is most of us, including myself, are kind of working on quality assurance, disease surveillance, and capacity building. And we'll see a little bit detail in terms of some of the progress that PEPFAR has been able to establish. And also, improving access to, HIV services, including testing. Some time back, we're talking about CD4, now it's viral load, early infant diagnosis. Countries have been able to scale up these services, because of the support that they got from the implementing partners and, of course, through the funding. And most importantly, really now, we're able to have, we as laboratorians can boast about, providing quality services, because I remember when I used to be in the lab, clinicians actually don't value the test results that is coming out of the lab because they feel that it's not of the quality that is needed. But now that has dramatically changed in terms of how things have gone up. Now, the other aspect that is really in support of PEPFAR is the procurement. And this is where USAID actually lead in providing procurement services to African laboratories. And we know that most of the procurement ranges around reagents, equipment, and supply. In HIV test kits, viral load, equipment purchases, rental services agreement, etc., etc. And recently, implementing what we call the all-inclusive service agreement, and then the diagnostic network optimization. So this is really part of the comprehensive package of supply chain services to help manage HIV and to help make sure that countries are on the path to achieving HIV epidemic control by 2030. So with that, really, I know a little bit more in terms of what the procurement and supply chain is. And the procurement or supply chain actually from the bulk of PEPFAR funding that we get. And so, for example, in 2019, almost $3 billion worth of procurement that was actually procured by implementing agencies. So this really is kind of the bulk of the work that has been done by Kemoni's PSM project in terms of delivering this large volume of product, life-saving product, to 34 countries. So when you look at this number, why am I bringing this number as kind of part of the introduction? You see that 64% of 2019 numbers is actually made up of ARVs. And with that, 26% is lab and diagnosis. So because of this group focusing on the lab and diagnostics product, you see that 2029 FY 2029 commodities alone to 34 countries value around $779 million. So what does this mean? If 34 countries, procurement to 34 countries is around 800 million in 1 year. So the implication of the funding freeze is that these 34 countries, these participating 34 countries and receiving PEPFAR laboratory support, are collectively looking to replenish around 800 million from their domestic or alternative funding sources. This actually represents around $24 million per country per annum for lab and diagnosis procurement. Think about that for a moment. How many of our countries really have that kind of budget of allocating approximately $24 million in 1 year just for lab and diagnostics product alone? And this number actually increased when you think about ARVs. But focusing on the lab and diagnosis, in 1 year, over 700 million in 34 countries, meaning that each of these countries, the gap that we are expecting for them to have if the procurement is flatlined from 2019 up to 2025, is that $24 million is what most of our countries in Africa will need to be able to fill in the gap. So let's really, let that sink for us as laboraticians as we begin to kind of advise our government, and also as we participate in making sure that these gaps are filled. This is the numbers that we have to put in our mind to make sure that our countries are getting. Now, before we move into forward, I wanted to kind of bring our attention in some of the key event milestones for me that has shaped laboratory practice on the continent. So there's a lot that I put in here, but I just kind of put in this 10 milestone to see that this transformative moment for us as laboraticians as we went through the years of PEPFAR support. Starting from the launch of PEPFAR in 2003, and some of us who were there at that time in 2007, there was a meeting in Maputo, Mozambique, where we came out of what is called Maputo Declaration, which actually recommended the formation of tiered laboratory network in most of the laboratories systems work. And with this, actually, countries bought into it. I remember doing a harmonization workshop in Zimbabwe. I remember doing a harmonization workshop in Zambia, where really the idea was, try to streamline, services or standardized services. So each level of healthcare, in Zambia, for example, we had like 4 levels of healthcare. You have the health center, you have the district level, you have the provincial level, and then you have the regional or the specialist hospital level. So each level has a standard test menu that is being able to provide in terms of the services that it can provide to the patient. And so at that time, if a level is not able to fulfill a service at that level, they have the liberty to transfer sample to the next level. And so that is where the issue of sample transport network started. Prior to that, when a patient comes to a level and you don't have the facility or the test that is required, you transfer the patient to go to a next level. What happened is that there was a very high loss to follow up. Patients don't go because they struggle to come to your level. How are they going to go to the higher level? So the sample transport network came in. And of course, in 2011, the establishment of ASLM. For me, I think one of the dynamic key milestone in laboratory practice on the continent is the establishment of ASLM. And I think the leadership, the strategic thinking of establishing that kind of body to help advance laboratory practices on the continent really was an excellent idea. With that, I think countries have now been able to kind of put laboratory practice on the table. Previously, we don't, laboratory practice is kind of at the sideline. So even, I've been to laboratories in terms of assessment where the laboratory is actually the last thing to talk about because, when they were established in the hospital, there was no laboratory. So at the end of the day, okay, there is an abandoned restroom here. Let's let them go there and begin to do their testing there. But with ASLM, I think the advocacy, the policy, infiltration to make sure that countries establish some level of structure for laboratory services is well documented. And I think the other one is, of course, the establishment of Africa CDC in 2016. For me, I think these two agencies are agencies that we need to hold them very strong in our arms to make sure that we support the work that they are doing to ensure that we have advanced laboratory practices on the continent. Of course, others including all-inclusive service level agreement, country transitions that have started. When I talk about country transitions, I'm talking about areas where, example, in Uganda, where MAL, Medical Access Uganda Limited, is kind of taking over the procurement and distribution of laboratory reagent from PSM. So that really shows you in terms of how the progress that we've been able to establish, and this event has really transformed laboratory practices on the continent until January 2025, when the stop order work was established. So with this, milestone event that we have established, let's now go into a little bit detail to talk about some of the progress specifically within the laboratory network in Africa. So the next two slides is really gonna establish some of the key aspects of the technical support and also the procurement that PEPFAR is kind of looking at. Nearly 50 countries now have to kind of bring themselves hope in over 50 countries due to the investment of over $10 billion, been invested in life-saving diagnosis alone. So it shows you that really procurement and supply chain has really helped, improving some of the, laboratory practices that we have. And in addition to that, also standardization was key, through the SLAMTA program that was championed by CDC. The last time I was checking on the website, over 400, plus labs are now able to meet international standard, ensuring accurate diagnosis, through their accreditation in ISO 15189 and ISO 17025, for clinical lab and also quality control labs, across the continent. So this, for me, is kind of a major progress that we have to be excited about. Now, the other one is really improved testing. So we've seen a whole lot of training that's been, taking place. I think recently there was biosafety training that ASLM is organizing, right now. I think last week, or it's still ongoing. I'm not sure about that. But yet it shows you how, most of our colleagues have been trained. I mean, I'm one of those who have done a couple of training of trainers, a couple of benchtop training, a couple of policy and all those training that we to do over the years, to make sure that our personnel, lab personnel, or all of us are able to, to respond and prevent, detect, and respond to the outbreak and emergency pandemic. And we saw that really happen during the COVID-19, where most of the countries, under ASLM and under Africa CDC were trained, even up to, genome sequencing, of COVID-19 or SARS-CoV-2 virus. So that really shows you that this support has been significant in transforming, laboratory systems and also laboratory services on the continent. The other areas of care that I have seen, in progress in terms of the increasing access to viral load, and that based on the UNH 9595 target, where the last 95% is viral suppression, which is kind of an indicator of HIV pandemic control by 2030. So with that, I've seen more countries, actually moving, towards achieving the 95% viral suppression. And there's a lot of, the last time I checked, it's almost 10 countries in Africa have actually progressed towards that. Some have really achieved the 95%. Some are very close to achieving the 95%. And so this progress are likely going to be affected, if action is not taken. Now, the other aspect is the human resource. Countries now have been able to establish really critical human resource pool through pre-service training. I think my colleagues in Zambia, if they are here, will tell you some of the work that they did in establishing, supply chain curriculum within the laboratory services curriculum in most of the training institutions. So I remember some time back we did a training of trainers with the professors in Zambia, in Nigeria, to make sure that they're able to teach, supply chain as part of the normal teaching curriculum that they have. And the other progress is really supporting local economic growth and stability, with the current dispensation that PSM and the USAID specifically is leading. It's really providing some grants to local businesses and helping them with technical transfer to be able to take over some of the work. And I gave an example of MAL in Uganda being able now to completely, transition what the PSM project is doing to local businesses. So that is really in terms of helping, local growth. And lastly, it's about, local contract for last mile distribution. Uganda has their last mile distribution and sample referral network using the border that go in from, from the districts, to the last miles to make sure that, samples are collected and results are returned back. The same thing in Nigeria also had, similar event that is established to make sure that services have been able to establish or to reach to the people who need them. Big but, that these are all at risk. This progress that we have seen are all at risk because of because of the stop order that was established because of this thing. So really some of the key areas of risk that I look at, there are three areas that I have looked at is, number one is the high dependency on US funding in African laboratories. A lot of countries, in a recent UNAIDS weekly update out of March 3, 2024, shows that, countries have in Africa actually over 80% dependent on US funding in their services that they provide to clients, in this case to patients. So you can see that Malawi about 88%, DRC 87%, Zimbabwe 83%, Mozambique 82%, Eswatini 80%, and Uganda and Lesotho below 70%. And so looking at it coming down, you see that some countries with the yellow have mixed funding where they have 30 to 60%. and then others are in transition, and domestic leadership is the last one. I mean, we want to see more and more African countries at the lower level, which is the domestic leadership, which means that these countries have been able to kind of commit, their own resources to support the population instead of relying on the US government funding. So with this, really it tells you that some of these countries that we saw with 80% and above means that they are at risk of losing almost everything that they have, progressed, over the years if they are not able to kind of fill in the gap that is left by US funding institutions. And the other thing is really now what we see over 200,000 people, health workers, including nurses, lab technicians, logisticians, are left without support. Of course, including myself, who have been working on a paper for like over the past 20 years, is that everybody is left, without means of supporting themselves, their families, and the expanding. And we know how, Africans, it's not just one person who is being supported. One person is the one who is responsible for the entire village. And so if that person whose means of livelihood is taken over, means that, it's not just an individual who is affected, it's the whole village that is affected. And so other really main numbers, we see that over 233,000 people globally have lost their job. And the other risk is actually in terms of the goal of establishing viral suppression by end of 2020, based on the UNAIDS support, is also at risk. And of course, infant mortality. When you look at it, there is and PEPFAR impact counter, it's estimated that almost 6,000 children have lost their lives since January 24th, 2025. So this tells you that we are losing the next generation at a faster rate than we have anticipated, because we have been able to establish very good PMTCT program where early infant diagnosis is for us, the lab force, where we do a lot of EID, testing to make sure that we're able to capture infant at that early age. And yet this is going to be, we're going to lose this progress moving forward. But there is hope. I have, 4 call for action that I kind of propose for us to be able to look at and make sure that we are able to address the funding gap and anything that is happening in order to address the funding freeze. The first call for action for me is the Africa Resilience Fund. Now, this fund, my thought about this fund is, to be modeled along the line of Global Fund and UNAIDS, where maybe on an annual basis we convene. So I'm at the slide that is talking about call for action. Probably Francis, maybe you can kind of put that, since we have already have that backup plan for us. So put that slide up. I think that is slide 14. That is the first call for action, which is modeling Africa Resilient Fund. This could be the entire, we say, health system fund, or it could be a laboratory fund, where I think we call, African financial institutions, such as Africa Development Bank, such as Africa Export Bank, Afro-Exim Bank, and then some really core African philanthropies. That is, I think, slide 14. I'll continue like this, don't worry, so that we can move forward. We can wait any longer. Yeah. So I was talking about, so that is not the next one. The next, yeah, here. Yeah. So my perspective is that we can kind of do this on the continent, by inviting African institutions, immediately convene a commitment forum where we have African financial institutions, African philanthropists, and some African diaspora, to come in together and see what kind of commitment we can do on the continent to make sure that we are able to, address all this funding gap that we have here. Now, the second call for action, the next slide, is about domestic mobilization. Here, I'm talking about, creating an institution where Africans must invest in their own population. So it is us who are supposed to take care of our population, not someone else, not another person, not another institution, not the US government. So we need to begin to mobilize our own local resources. Here, I'm actually proposing that at the Africa Union level, we can have countries have a mandatory minimum percentage of their national GDP going into health systems, or even specifically going into diagnosis services. So with this, it will help bring in health as a mandate for the government of the day, so that instead of depending on foreign aid. And of course, some of the areas to look at is maybe university taxing scheme, where a little bit of tax that will be taken off based on, providing, for example, in Ghana, they have the NIH tax. So that goes to the NIH. And so something similar in other countries could be affected. The third one, the next slide, is actually local innovation. I mean, why can't we bring Silicon Valley to Nairobi? So from Silicon Valley to Nairobi, why don't we build our own? Why don't you have innovative way of promoting entrepreneurship in our youth? To take up production of goods and services. There is a whole lot of um, um, innovative ideas on the content that we can use. Creating science and technology startup hub, Silicon Valley type of innovation hub, and providing low interest finances mechanism to small scale, manufacturers, to make sure that they get this. And then lastly, the next slide is about partnership. This is very, very important, because forging public-private partnership is an important way of getting us to work together. I know that during the work that USAID has done, especially for the diagnostics world, we've been able to bring in together, the Roche, the Cephid, to really sign in the all-inclusive agreement, transitioning some of the challenges and the risk that the government is taking to the private sector. So these contracts are still there, and I think it is up to us to kind of go in and see where are these contracts are, and can our government go in to take over from PSM, for example, to make sure that we continue to enjoy the partnership that we have, and also partner with international patent manufacturers for technology transfer. I think if we are able to get, countries providing us, private sector providing us with technology transfer on the continent, I believe that we'll have a long way to go to make sure that we are able to produce whatever we need on the continent. Now, I think these are the kind of the four key recommendation that I think for us to be able to do. And I welcome any additional recommendation from the group here, because really we are very good in coming out of innovative ideas, so that when we crowdsource, I think all the people will help us to take it that. Now, the final thought for me is that I know that Africa is strong. We must act now as Africans, not tomorrow, not next year. The health of the continent depends on us. The health of the continent depends on us. It doesn't depend on United States government. It doesn't depend on anyone outside the continent. It depends on us. And why do we have to do that? Because at least for US foreign aid will never be the same again. Recently there is Congress is about to pass a legislation where the Trump administration is returning some of the $9 billion left over from the previous commitment of foreign aid back to chess. So which means that this $9 billion is not something that we're going to get in Africa to run our program. We need to rise up and do it. I know that we are very resilient, people in Africa, and we always rise above the occasion. And this is another occasion that I strongly believe that we can rise above this occasion as well. We can create the Africa we want. AU has that we need to create the Africa we want, by 2060. And I'm very sure that we can do that, and we can do that together. and we can do that far. I mean, there's an adage that is saying that if you want to go far, you do it together. If you want to go fast, you do it alone. But in this case, I know that we can do it together, and we can also go do it alone, because we are capable of doing it if we put ourselves together, and we are ever capable of doing it alone as Africans with no one helping us. So with that, maybe the next slide is I want to thank all of you for your time, especially to ASLM for giving me the opportunity to discuss this important topic with all of you. And with that, I yield back my time to the organizers. Thank you.
Excellent, Dr. Umaru there, and very great insights. Colleagues, again, Collins, just be on the lookout should I begin struggling with connectivity. Very excellent insight there, I was saying, Dr. Umaru, and generally we can do it alone. For sure, we have what it takes to move the continent to the next level. And if anything comes from out in terms of foreign assistance, we can then take that as a bonus and work with such bonuses to make the continent a better place. Colleagues, keep your questions coming through the Q&A space. We will deal with those that we can deal with in the next 10 or so minutes. And then those that we cannot, we will compile those and make them available to Dr. Umaru, and then he will give us the responses that then will be subsequently shared with you. I have one quick question that came directly to me, and I want to put it right away. And the question relates to the fact that you've made these calls for action, and most of them are working within our means as a continent, countries within the continent.
Yeah.
What about, because we also know that PEPFAR will come back in some form. It may never be the same PEPFAR. The scope will change. The name might change. But how should countries position themselves so that in that new formation of this foreign assistance, we can then make the best use of what then comes through?
Sure, Francis, that is an excellent question. So yes, one thing for me, I think, yes, it may come up because now it's been transitioned into State Department, and if that is the case, some of the waivers probably will be given. But let me emphasize and re-emphasize that even if that is going to be the case, it's not going to be much in terms of what we'll be receiving recently or currently as PEPFAR is like. But I think moving forward, what we need to do is when we reposition ourselves, to take up whatever is going to come as supplemental, not really as a main driver of our work. And I think that is what is going to help us. I want us to kind of start locally, and then, like mentioned earlier on, to use whatever supplemental that is going to come to as a supplement to fill in any gap that we have. But for now, let's work together, and together and alone to make sure that we have recognized a way of, using our own resources, and then use PEPFAR funding if it comes out, to make sure that it becomes a supplemental for the work that we do. Over and out.
Thank you, Dr. Umaru. Again, there is almost a related question from Christopher, and Christopher speaks to weaning us from the support that we have been depending on for 20 years. Mm-hmm. And I think his thoughts are around responsible taking out of the support, because we've been made to depend on this for the last 20 years. You don't come in a stroke of a minute and then say it is not going to happen anymore. And so he speaks to weaning us off this support. But I am adding to that and saying, yes, we've been getting this support, and it looks like the design has never been part of, we have never been part of the design. Mm-hmm. And so is it possible that in the next phase of the funding support, we also make our voices be heard. Even when we are receiving, there should be some criteria that should be met so that it is supportive other than making us very dependent in some way. So two aspects to this, the aspect of responsible withdrawal, but also as being part of the design of whatever support that comes our way.
Yeah. So I think the first aspect of responsible withdrawal is, unfortunately, that responsibility didn't come out because, with the with the America First agenda for this current administration, it's more about looking internally on the in the U.S. to make sure that the taxpayers' money is well utilized. Locally. Locally means that in the United States. And so that was kind of the reason why the sudden disruption that came in. I mean, it took all of us by surprise. But that being said, I think it's a learning for us as Africans to understand that nothing is permanent as with regards to foreign aid. We cannot assume that it will continue to flow. It will be what it used to be, in the past. But the other aspect of it is that I think where you look at what next is that, so far, I'm not sure, maybe it has been done, but I've not seen any critical action that has been taken by our leaders, to reach out to the Trump administration, for example, and say, yes, when you are doing your next iteration of PEPFAR funding, or you are doing the next iteration of port, we want to be part of that process. Because even when PEPFAR is being started, I don't think, like you say, we're not part of it. Why? Because we didn't kind of recognize the responsibility for us to institutionalize the fact that we want to be part of the design of any work that is coming on. So it all comes back to what our calling is, that let's rise up as Africans. Let's show to the rest of the world that yes, we are capable of managing our own affairs. And therefore, if you are designing something for us, we need to be part of the table, or we need to be on the table to let you know exactly where we are, where our needs are, and therefore how best we can use your supplemental funding for ourselves. Over and out.
Great. And Dr. Umar, you're by yourself, and so you'll take all the bullets coming your way. But allow me also recognize some of the comments that are coming through from colleagues, great suggestions on what could be done, and we'll see how to package some of those to make them available to our attendees. There is a comment that is coming in, and it refers to the fact that some of the achievements that you have listed from PEPFAR. Of course, there are those that are durable and they stay beyond just funding cycles. But a significant number of some of the achievements are actually achievements, and they continue to be successful only when there is continued funding. And so, like you indicated, that we should generate some of our own funding models and model them around the current Global Fund, the current PEPFAR. Should we not be cautious that as we as a continent, as a region, as we model our funding mechanisms, we should make sure that the funding mechanisms are durable and can last beyond the funding cycles alone?
That's right. And I think for me, not even just durable, but well managed, because that is really very critical. We can get philanthropies, institutions that are really ready to provide that kind of support. And actually, it's long-term support. But we need to be able to establish a mechanism to bring in confidence in making sure that the funding that they are committing are actually being used efficiently or effectively. And an example is, I mean, you heard, where Bill Gates himself was talking about in the next, I think, 10, 20 years, spending down to zero or more all his fortune, but then being focusing on Africa is kind of his priority. So how are we really positioning ourselves to get this goodwill from Gate Foundation, for example? So that is the kind of question that we need to kind of begin to ask ourselves internally. Really, it's not just about really for me even organizing this kind of forum and asking people to commit, but what is the guarantee? What is the assurances that we can give them to let them realize that yes, regardless of how much contribution they are going to make, is going to be utilized in a most cost-effective way and is going to be maintained in a long and sustainable manner to make sure that those people who need the services actually get the services. Over.
Thank you. Thank you. And we'll take one more before I hand it over to you to give us your closing remarks. And colleagues, like I indicated, kindly keep the questions coming. Those that we can't deal with, we will definitely pass them over to Dr. Farouk Umaru. There is a question from Alpha A. Diallo, and it refers to one of the facets that you spoke to in trying to create the source of funding for the continent. And he's saying, Dr. Farouk, how do you suggest that the diaspora in the US can constitute a PAC for support? What would be your suggestion? And I'll ask that
Can you repeat the question again? Because I was transitioning to listen, so I didn't hear. Sorry.
Great. So Dr. Alpha says that how do you suggest that the diaspora in the US should constitute a PAC for support?
Yep. Yeah. You know, I think that is an excellent question, because I thought that, myself, to see that, I think that is a source of support that has been neglected, because that those of us in the diaspora almost on a daily basis send fund home for family, for upkeep, for all those things that is going to. But is there a way of rechanneling this kind of funding that is coming out of the diaspora, to make sure that it is being redirected to a specific health, for example, health service, for example. So one of the things that I think Ghana did was to how they call electronic transfer tax. I mean, it's not been done very well in that perspective, but if it can be restructured and be made very well, I think that could be a source of fund. If it is even 5% or 2% or 3% of any funding that is coming out from the diaspora, is taken in channel into health system strengthening. That is another one way of doing it. The other way of doing it is in convening some of these forum that I was mentioning in. Let's not forget that there are others within the diaspora that are kind of philanthropists by themselves that could also help, that could support, if that guarantee is there that the funding that they are going to contribute is actually going to be used in the right perspective for the right cause. Over.
Thank you. Thank you very much for this exciting talk, Dr. Umaru. And colleagues, kindly be reminded that the article that was published in the African Journal of Lab Medicine, I shared the link on the chat. You can actually access that and read further some of the suggestions that are out there from Dr. Umaru. But also get to know that as a continent and as individual countries, there is so much that we can do to support the health of our people, the security of our people, the feeding of our people. And also, just last but not least, there is so much capacity on the continent, and most of the PEPFAR program and other funding programs were generally actually being managed and run by colleagues and members of the continent. And so with that capacity, we should be able to do so much to make sure that the continent is more self-sustaining. But with those, let me just give you a minute to give us your closing remarks, Dr. Farouk Umaru.
Yeah, thank you very much, really, for your time, and thank everyone for listening to me, for giving me an hour of your time. I think my closing remarks goes back to really the call to action. I mean, it is time for us to rise up to the occasion. We've seen how sudden this has come. So we are actually in an emergency mode. We cannot wait any longer. We cannot wait to see how PEPFAR is going to transform. People are dying right now. People need services that they are not getting. So let's not wait, until maybe all the, technicalities of the transition is complete. We need to get up and rise. I want to recognize that, yes, some countries have started making their own effort in their own small way, but there needs to be a consolidated effort at the continental level where ASLM, Africa CDC, AUDA, NEPAD, and all of them, really all the technical institutions coming together as one entity and present a common front to the leadership to make sure that we are able to rise to the occasion. And I think it's also up to us, each and every one of us, to support this kind of initiative, this kind of effort by the leaders to advance our work and take us to the next generation. Over and out, and thank you for your time.
Excellent there. And colleagues, Dr. Omar Adams Farouk, the order does not matter.
Yes.
What an insightful talk. And we look forward to hosting you again. We're working with individual countries to share with us their practical steps they're taking to make sure that they can mitigate against this, the negative impact of the funding freeze that we're going through. And at some point, we may actually ask you to join some of these countries just to give us alternative insights. And with those colleagues, allow us bring this to an end. And from us, ASLM, we wish you the very best of your afternoon, evening, or morning, depending on where you're joining us from.
Thank you. Thank you.